Good morning. This is Follow the Science Monday COVID-19 update. I'm Dr. Paul Juarez, professor and vice chair for research in the Department of Family and Community Medicine at Meharry Medical College. I'm also principal investigator of the Tennessee Community Engaged Alliance Against COVID-19, also known as Tennessee SEAL. I'm also site PI for HealthWorks, a HRSA-funded COVID-19 prevention program established through a subaward with the Morehouse School of Medicine. Today is Monday, October 17th, 2022. While the U.S. has extended the COVID public health emergency through January 11th, a clear demonstration that the Biden administration still views COVID as a crisis, despite President Joe Biden's recent claim that the pandemic is over. The public health emergency, first declared in January 2020 by the Trump administration, has been renewed every 90 days since the pandemic began. HHS Secretary Xavier Becerra told reporters in a call last week he would give 60 days notice to states, healthcare providers, and other stakeholders before lifting the public health emergency. Whenever the public health emergency does finally end, it will have dramatic impact on healthcare in the United States. HHS estimates that as many as 15 million people will lose their Medicaid coverage. Hospitals also risk losing the flexibility they have begun to rely on during COVID, including expanded use of telemedicine. Millions of struggling families will also lose supplemental money through the federal government's nutrition program. In addition, HHS has overridden state laws that in some cases limited which vaccines pharmacists could administer to certain age groups. It's not yet clear whether the nationalization of pharmacy vaccine rules will expire when HHS decides to lift the public health emergency. This week, I'm going to talk about why CDC experts expect another COVID winter. First, there are several new subvariants of the Omicron variant that have emerged. Second is a low percent of people who have received the new bivalent Omicron booster. Third, the onset of winter means that people will be spending more time indoors, a better environment for the virus to spread. New cases of COVID-19 have actually increased over the past 14 days by 52% in Germany, 30% in France, and 25% in the United Kingdom. Deaths there have also surged, up almost 100% in the UK, 75% in France, and 40% in Germany. The past two winters have seen cases surge in Europe first, followed by New York, California, and then the rest of the country. While cases from the past 2 weeks in New York and California both continue to decline, we are still early in the fall. So although the pandemic is headed in the right direction with cases, hospitalizations, and deaths in a sustained, steady decline, many officials and experts believe another uptick is likely over the fall and winter. And while the U.S. is now quite familiar with the Omicron subvariant BA.5, which has been dominant for months, other subvariants are starting to account for larger shares of cases. Several other Omicron subvariants are now in circulation, including BA.4.6, BA.2.75.2, and XBB. All of them are highly evolved. Many of them actually share a subset of key mutations, especially on the spike. While we haven't seen large numbers in the US yet, there are other countries that have. So although we can feel good that we're going in the right direction, We can't let our guard down. Fauci said Tuesday, as it appears that the late summer hiatus we've been experienced with regard to decreasing cases, hospitalizations, and deaths due to COVID-19 may be coming to an end. Test positivity has increased in recent days and remains relatively high after falling consistently since July. If that trend continues, it could be an early sign of a growing outbreak in the US, similar to the one seen this month in Canada and Western Europe. The Omicron subvariant BA.2.75.2, a newer coronavirus strain some scientists fear could be problematic, has arrived in Los Angeles County. BA.2.75.2 has been described by Dr. Anthony Fauci, President Biden's chief medical advisor for the pandemic, as one that looks suspicious, that it might start to evolve as a troublesome variant. A new subvariant of the Omicron variant is called XBB and has dramatically announced itself with flair this week in Singapore. New COVID-19 cases there more than doubled in one day, from 4,700 on Monday to 11,700 on Tuesday, and XBB is almost certainly why. The same subvariant just arrived in Hong Kong too, a highly mutated descendant of the Omicron variant of the SARS-CoV-2 virus that drove a record wave of infections starting around a year ago. XBB is in many ways the worst form of the virus so far. XBB has at least 7 new mutations along the spike, mutations that, taken together, make the subvariant harder for our immune system to recognize and thus more likely to evade our antibodies and enter our cells to cause infection. All 3 of the new subvariants are more contagious than any previous variant or subvariant. They also evade the antibodies from monoclonal therapies, potentially rendering a whole category of drugs ineffective as COVID treatments. It is likely the most immune evasive and poses problems for current monoclonal antibody-based treatments and prevention strategies. The Omicron subvariant called XBB appears to be gaining traction in Asia, while a close cousin of XBB called BQ.1.1 is spreading fast in Europe and in some US states. Observations from countries with the XBB subvariant have suggested that it is least as transmittable as current variants, but does not cause more severe illness. There are others in contention, though, including BA.2.752. These viral cousins, called the Scrabble subvariants, are a jumble of scientific designations of closely related viruses. At least 2 of the Scrabble subvariants, XBB and BQ.1.1, are pretty much unrecognizable to existing antibody therapies and somewhat less recognizable to the antibodies produced by the prime doses of the leading messenger RNA vaccines. In evading some of our therapies, and to a lesser extent our original vaccines, XBB and its cousins are showing us where the novel coronavirus is heading, genetically speaking. The current surge in infections in places like Singapore is a preview of potential global surge this coming winter or spring, and as XBB or one of its relatives becomes dominant everywhere. The good news is that the new bivalent vaccine boosters from Pfizer and Moderna seem to work just fine against XBB, even though the original vaccines are less effective against XBB. They won't prevent all infections or reinfections, but they should significantly reduce the chance of severe infection, potentially leading to hospitalization or death. Even with immune evasive variant vaccine protection against what matters most, severe disease, remains intact. Health officials and experts have noted, however, that higher risk people who haven't gotten a booster recently are still at high risk of dying, and death rates, while improving, are still significant. Nothing is 100%, not natural immunity, nor are vaccines. So, taking steps to be careful and cautious about trying to avoid getting infected still is a sensible step to go. There is growing evidence of an increased risk for long COVID among survivors, including persistent symptoms of fatigue, reduced exercise capacity, breathing problems, brain fog, and loss of taste or smell. But beyond long COVID, there's another reason to get vaccinated. Italian health workers for 2 years found that 31% of infected non-hospitalized people had long COVID symptoms that lasted more than 4 weeks. But the more vaccine doses healthcare workers had, the less likely they were to later report long COVID, the study said. And so, as the novel coronavirus evolves to become more contagious and more resistant to certain types of drugs, keeping current on your boosters is the most impactful thing you can do in preparation for what might come. Only around 7% of people in the United States currently eligible for the updated bivalent COVID booster have received it, even though pharmacies and other vaccination sites began administering the new shots around Labor Day weekend. Everyone ages 5 and older are now eligible for a bivalent Omicron booster shot. With the onset of winter driving people indoors, the waning rates of immunity from prior infection and vaccine, and the new subvariants that are emerging, you shouldn't wait any longer to get the new bivalent Omicron booster. More and more people, or health officials, are coming around to the idea of an annual Omicron booster. Even Joe Biden endorsed this idea in a statement last month. As the virus continues to change, we will now be able to update our vaccines annually to target the dominant variant. Just like your annual flu shot, you should get it sometime between Labor Day and Halloween. And finally, I'm going to turn to the current COVID trends. Nationally, new reported cases have fallen by about 20% in the past 2 weeks to an average of fewer than 40,000 cases per day. Cases are falling in nearly every state, with the Midwest and South seeing some of the largest declines. Hospitalizations are also decreasing in most states, though they have ticked up in recent weeks in much of the Northeast. Hospitalizations are down 4%, and ICU admissions are down 7% over the past 14 days. The number of deaths announced each day remains persistently flat at just under 400. An average of 768 cases per day were reported in Tennessee over the past week. Cases have decreased by 14% from the average 2 weeks ago. Deaths have decreased by 16%. Shots since the beginning of the pandemic, at least 1 in 3 residents of Tennessee have been infected, a total of over 2.2 million reported cases. At least 1 in 246 residents have died in Tennessee from the coronavirus, a total of 27,717. There are currently no counties in Tennessee in the CDC's red zone for community COVID level, and only 4 are now in the yellow zone. Counties in the yellow zone include Lincoln in southeastern Tennessee, and Carter, Washington in northeastern Tennessee. 91 counties are now in the green zone. The percent of the population of Tennessee that has completed the primary series has finally ticked upward to 50%, 56%, and 26% have received the first monovalent booster. However, Tennessee ranks 44th among states for percent of people fully vaccinated. The takeaway is get boosted, don't wait, and be prepared to get boosted again in 2023. For now, this is Dr. Paul Juarez from the Tennessee SEAL and HealthWorks of Meharry, wishing you a good day. Be safe.